Today's nursing mindset is about sleep. Sleep is something we all need, but as nurses, we know it's much more than simply closing our eyes at night. Quality sleep is essential for healing, for learning, emotional well-being, immune function, and cardiovascular health. When patients aren't sleeping well, our responsibility isn't just to hand them medication. Our responsibility is to understand why they aren't sleeping, and choose the safest intervention. Let's walk through the nursing approach. Step 1, we're going to start with assessment. Before thinking about medications, begin with a thorough assessment. Ask your patient, how are you sleeping? Do you have trouble falling asleep, staying asleep, or waking too early? How many hours of sleep do you usually get? What does your bedtime routine look like? Remember, the patient is the best evaluator of their own sleep. Poor sleep may be temporary, or it may become a chronic problem that affects nearly every aspect of health. Step 2, identify the cause. Insomnia is often a symptom rather than the primary problem. So ask yourself, is this related to stress, anxiety, pain, illness, medications, caffeine, alcohol, poor sleep habits, changes in schedule or changes in travel? Treating the underlying cause is often more effective than simply treating the symptom. Step 3, promote healthy sleep habits. Before reaching for a medication, always consider non-pharmacological interventions first. Encourage patients to maintain a consistent sleep schedule. Create a quiet, dark, comfortable sleep environment. Limit caffeine, alcohol, and nicotine, especially in the evenings. Avoid screens before bedtime. Exercise regularly, but not immediately before bed. Develop a relaxing bedtime routine. These simple strategies are often enough to improve sleep without medication. Step 4, use sleep medication safely. Sometimes lifestyle changes aren't enough, and medications are appropriate. Rather than memorizing every drug, focus on the major nursing considerations for each medication class. So let's start with antihistamines. So this is going to be like your diphenhydramine, or what we call Benadryl. And this is commonly used as an over-the-counter sleep aid because its side effect is that it causes drowsiness. So I think you might remember in pharmacology, we learned that Benadryl or diphenhydramine, oftentimes it's used as a sleep aid because of its off-label use. That's an off-label use for it. However, it also has anticholinergic effects, which can cause dry mouth, urinary retention, constipation, and confusion. For that reason, it should be used cautiously and is generally not recommended for routine use in the older adult population. Next, we have our benzodiazepines. So that's going to be like your lorazepam or Ativan, your alprazolam, diazepam, and your temazepam, or what we call Restoril. Now, these medications enhance the effects of GABA, so that means that it's going to help to slow the activity in the brain and promote relaxation and sleep. They can also be used, though, to treat anxiety. So here, important nursing considerations include that they should be used for short-term treatment whenever possible. Also, avoid alcohol because it increases central nervous system depression. Never stop these medications abruptly after prolonged use because withdrawal symptoms can occur. Remember that temazepam, or Restoril, is generally considered the preferred benzodiazepine option for the older adult because it is shorter acting. But we also have non-benzodiazepines. So this medication that we'll focus on is going to be your zolpidem, or what we commonly refer to as Ambien. This medication should only be taken when the patient can remain asleep for at least 8 hours. So here we want to teach our patients to take it right before bedtime on an empty stomach because food will slow the absorption process. We also need to make sure that we monitor for confusion, dizziness, and fall risk, particularly in older adults. And then finally, we have our melatonin agonist. That's going to be your Ramelteon or Rezuron. This works by mimicking the body's natural melatonin. Instead of causing general sedation, it helps regulate the normal sleep-wake cycle. It is especially helpful for patients who have difficulty sleeping and is often a good option for the older adult because it carries a lower risk of dependence. All right, step 5. No matter which medication is prescribed, the nurse's responsibilities remain the same. Assess thoroughly before administering the medication. Teach the patient about how and when to take it safely. Monitor for side effects such as excessive sedation, dizziness, confusion, respiratory depression, and falls. And then finally, evaluate whether the medication actually improved the patient's sleep without causing unnecessary adverse effects. Remember, our goal isn't simply to help patients fall asleep. Our goal is to help them sleep safely. So I'd like to leave you with one final thought. Sleep medication should never replace good sleep habits. As nurses, we always begin by identifying the underlying cause of insomnia and promoting healthy sleep practices whenever possible. However, when medications are needed, we choose the safest option, provide thorough patient education, monitor closely for adverse effects, and continually evaluate whether the treatment is achieving its intended outcome. Helping a patient sleep isn't just about giving a pill. It's about restoring healing, promoting safety, and improving quality of life. That's the nursing mindset. Keep working to develop yours.